Pain and discomfort. Is this what describes your menstrual period every month? Well, periods can cause uncomfortable symptoms such as cramps, mood changes, and breast tenderness, among many others. Mild symptoms can often be expected, but severe or unusual symptoms should receive medical attention. So, what are these symptoms that you should not ignore about your periods? Number 1. Heavy bleeding. This can take a serious toll on your body when a significant amount of blood is lost every month. Don't hesitate to seek medical care if you experience new or severe symptoms related to heavy menstrual bleeding. This is because heavy bleeding can be linked to anemia. Signs of losing too much blood during a period include bleeding through the clothes or bedding, needing frequent changes of sanitary pads or tampons, such as changing pads or tampons every hour, soaking your bed sheets, passing large blood clots, restrictions to normal lifestyle because of heavy bleeding. Heavy bleeding could indicate that there is a hormone imbalance or a health condition that affects the uterus. It is also advisable to seek medical help if you are feeling unusually tired, feeling faint or dizzy, or even looking pale. Number 2. Missing periods. There are several factors that could cause missing periods. Stress, excessive exercise, and some forms of birth control can all disrupt the menstrual cycle and therefore cause a missed period. If the cause is temporary, then a person's period may return as usual the next month. However, pregnancy causes periods to stop and they may not resume until the woman finishes breastfeeding. Some other causes can include eating disorders such as anorexia, extreme weight gain or weight loss, long-term stress, and even polycystic ovary syndrome. Number 3. Cloathing. Some cloathing is a regular feature of menstrual bleeding, particularly on days with a heavier flow. Clots that are small can often be expected, particularly at the beginning of a period. If you notice clots that are larger or appear more frequently than usual, it could indicate an underlying health issue, such as fibroids, endometriosis, or even adenomyosis. Also, if a woman who is pregnant or suspects to be pregnant passes clots, it could indicate pregnancy loss or miscarriage. If this happens, it is very important to see a doctor right away. Number 4. Unusual consistency. The consistency of a period may change from the beginning of the period to the end of the period, with a heavier flow to start with, which then gets lighter towards the end of the period. If you experience abnormal menstrual blood consistency, which is different from the usual consistency, you should see a doctor. Watery menstrual blood or unusually thick blood could indicate an underlying condition, and so you should definitely see a doctor. Number 5. Cramps. Mild cramping in the abdomen can be uncomfortable but expected as part of the menstrual cycle. However, extreme or unusual cramping could indicate an underlying condition such as endometriosis, adenomyosis, or even fibroids. Number 6. Periods not stopping. The duration of bleeding can vary from person to person, ranging from about 3 days to 7 days. For each person, it should be fairly consistent from month to month. If the duration of a period changes from month to month, or if the menstrual cycle becomes unusually long or too short, this can signal an underlying health issue, and it is a good idea to speak with a doctor about that. Number 7. Significant mood changes. After ovulation and before the start of a period, many women experience a combination of physical and emotional symptoms. Changes in the levels of hormones estrogen and progesterone can cause low mood, which is common. However, severe changes in mood, which may keep a person from daily activities, could be a sign of a disorder. People with this issue often benefit from a combination of lifestyle changes or medications. So, there you have it. By understanding your body, eating well, managing pain, resting, staying active, and nurturing your emotional health, you can make your menstruation experience a little more manageable. Most of these period symptoms can be managed from home. So watch this next video to know the home remedies you need to make your periods more comfortable.